All right, it is 16 minutes, 10 past 5 Lagos, and you are tuned into Smooth 98.1. Smooth Health is where we are at right now. And today on Smooth Health, we'll be talking about something that it is of utmost importance. And why do we say it's of utmost importance? Because it doesn't just affect one person, it actually affects each and every one of us. Whether it is that you're planning to have a baby, already expecting a baby, or just curious about what's really involved in supporting a healthy pregnancy, well, this conversation is for you. From checkups, from cravings, the myths that you've heard, we're going to be at least debunk some of them. And we'll be breaking down a lot of things, well, with the help of a doctor who knows the ropes. Yes, I'll be introducing my guest in a few. So what I need you to do is make sure that you have your notepads ready. And if you don't have access to that, what you can do is just pay rapid attention, because it's going to be very helpful for you. And you know how to support the mom and the baby that might be on the way. That is for those who are already on that journey. However, if you're thinking of going on that journey, what do you need to do? Well, that is why you need to be here. However, my guest this evening is Dr. Rotimi Oluwasiji. Good evening and welcome to Smooth Health. I'm glad to have you with me this evening.
Good evening, audience. It's a pleasure to be in your midst.
Indeed, glad to have you. Okay, so let me give you a bit, well, in case you're wondering, who exactly is he? He is a chief consultant, obstetrician, and gynecologist at Iwosan Lagoon Hospital. So you know that he comes with all the knowledge that is going to be very helpful this evening. So, like I said, sit back, relax, get your notepads, and let's get into the conversation. And I'd like to start, like I say, from the beginning, from the very beginning. And when I say the beginning, I want to know, what should a woman really check or know about her health before she even starts saying, okay, I want to get pregnant, I want to have a baby? What should she even know in the first place?
Thank you, everybody. And before I go directly to that question, there is a concept, a global concept of maternal mortality, which is death of a woman while pregnant or within 42 days of delivery from causes that are directly related to that pregnancy or its complication, and not because of incidental causes.
Okay.
And that is actually a taboo. No woman should die as a result of pregnancy. So that's why your first question is very important. When you want to get pregnant, what are those things I need to check? Now, there is a clinic called preconception clinic, where a couple that is then intending to get pregnant, we have to attend. And during that, a comprehensive checkup is done to find out if there are conditions in either male or female, the man or woman, that could negatively affect the pregnancy. So this is also a very good concept to make sure that the woman is healthy before she's pregnant. A very good example for a woman that has diabetes. If the blood sugar is not well controlled before that pregnancy, such a pregnancy is predisposed to congenital malformation, because sugar on its own is an independent teratogenic factor, meaning that baby may have structural defect as a result of elevated blood sugar in the mother. So there are some women also that have genetic disorders. A very good example is in some couples that they don't even know their genotype. Very important concept. So in such a clinic, you check, and this person be even fit. Is it good? Is it medically advisable for them to go through the journey of pregnancy because of the effect of what could happen if they have a child with sickle cell? You understand? It's a catastrophic condition for you to have a child that will have sickle cell disorder. It's associated with mental problems, social, physical. It creates stress in the family. So any factor that mitigates good pregnancy outcome have been taken care of in preconception clinic. Blood pressure, blood sugar,
Right,
the
right.
woman's blood group, genotype. When you have all this array of investigations, then you sit down with the couple and address them. Another one is that couples that have increased maternal age about 35 years, they are also susceptible to delivery to babies that have congenital anomaly. Down syndrome is a typical example. So all
Right.
these things are taken together in such a clinic, and the couple will be adequately advised.
Mm.
Then there are some medications you should take before you get pregnant. Very good example is folic acid. Folic acid is a component of DNA. You understand? At
Okay.
least you are supposed to have taken folic acid consecutively for 2 months before you undergo the journey of pregnancy. So, but
Okay.
you agree with me that in our present day environment, there are no couples just discover that they are pregnant. They say,
For
doctor,
pregnancy.
it has happened. You understand? Because they don't
Right.
come to this clinic before getting pregnant. So it is a very important concept.
Mm. Ah, the things we don't know and we just chalk away and think, okay, if it happens, it happens. But you don't know that
Yes.
there are things you need to be doing and putting in place for that pregnancy to be on the right path without any
Yes.
issues. But it's good that you're sharing this with us. And what was he talking about this, right? Well, there's something that I usually hear when it comes to um, well, I've heard amongst pregnant women or women who are trying to conceive, they said that eating healthy all the time during pregnancy is a thing. But does that actually, what does that actually mean? Is it that actually have to be mindful of what they're eating all the time? Especially for an expecting mother, she has cravings. So how is she supposed to be mindful of everything she's putting in her mouth? What does that even look like?
Yes. Absolutely. Balanced diet is essential in pregnancy.
Okay. Okay.
Although, as a result of physiological changes associated with the pregnancy,
Mhm.
gastrointestinal disorders, disturbances are common in pregnancy. For women
Okay.
that have peptic ulcer disease, the ones that are not even initially having peptic ulcer disease, they may start feeling, this gastric influx as a result of slow mobility of the
Mhm.
intestine due to hormones produced by pregnancy. So what we do is that we advise them, you take a balanced diet, fruits and
Mhm.
vegetables. For those that
Mm.
usually complain of instant satiety, we encourage them. You
Okay.
take more chunk at a time, but you increase the frequency. You understand?
Ah,
So
okay.
balanced diet is very adequate. Bearing in mind that whatever you take, that is
Mhm.
where the baby will also derive its own nutrition from through the
Very
placenta.
true. Very true.
So yes, it's good we have balanced diet, proteins, carbohydrates, fruits and vegetables, vitamins. Some of these food are also used in production of blood. A woman should not have anemia. There is nutritional anemia in pregnancy,
Okay. That
which
is
will also
something.
affect in the baby.
Okay.
Yes, anemia has deleterious effect on the baby, whether the growth of the baby, the cognitive development of the baby, brain development. So you agree with me that adequate nutrition, is very important during pregnancy.
Mm. That's actually very important, and it's not something one should brush off. So if you are an expectant mother, if you are on this journey, please be mindful of what it is you're eating. And yes, to you, the partners as well, it is where you to come in. You also need to be mindful and helpful, especially seeing that you both are on this journey together. It's not just her. Yeah, she's carrying, but you also need to be helpful with making sure she's eating the right things and having a balanced diet. Okay. And talking about balanced diet, sometimes whilst you're eating, you also made mention of how sometimes certain ailments already occur. But hey, some will say, I already have a medication that I'm using, so it's fine. I'll just keep doing that. In that instance where that a woman is pregnant already, Are there any are there any particular signs that she should be wary of and not just brush off to the side and say, okay, no, because it's ulcer or I already have my medication that I take, so it's fine. I will just take it and I'll be okay. Are there certain signs that she should not ignore and should actually see her doctor immediately? Those things occur.
Now, I want to start by emphasizing the fact that because of technology, programs
Right.
like this are to educate our pregnant women of how to go healthy during pregnancy, but it does not substitute for you to visit your
Good.
doctor.
Thank you so
As
much
a,
for
if when
saying
you see
that.
your obstetrician and gynecologist, is in total know-how of the drugs you are taking. Some drugs must be withdrawn during pregnancy because of the
Okay.
effects that you have on the baby. So while you withdraw that, you substitute with the ones that are actually safe in pregnancy. So it's not enough to say I'm on drugs, I'm
Mm-hmm.
pregnant, I'll continue my drugs. No. You need to
Mm-hmm.
see your doctor. He will be the one to tell you, okay, this drug is safe in pregnancy, including the
Right.
dosage, frequency, and everything. So I will still advise that early booking is very important.
Mm-hmm.
Pregnant, find yourself to the hospital, see your gynecologist, who will review all those things. Ask of the drug you are taking. The one to remove is going to remove it. The one to substitute is going to substitute it. Then some you even be encouraged because it's actually not easy to take drugs. This is
Mm.
where the role of our husbands you cannot rule it out.
Yeah.
Personally, I normally encourage when I see a husband following his wife to antenatal clinic. Honestly, I see
Awesome.
them first. You understand? I see
Ah,
them first. Yes, I do that. I have that bias that for you to leave your work as a man to come and know what is happening to your wife in clinic, you deserve that
okay.
accolade. So I give them that privilege. I see them first, and you agree with me that when you give two people information,
Mm-hmm.
it's likely to sink in more than the woman
Than
coming
just
from
one
doctor and
person.
say, my doctor
Right.
said this, my doctor said this. You understand? So early booking, very important. So all those things, we review your drugs. The one that are safe, we tell you to continue. The one that are not safe, we withdraw it. You understand? So that your
Right.
pregnancy, pregnancy is not only for you, it's also for your baby. Your baby must be safe, you too must be
Right.
safe. So that's why I'm saying that programs like this very good, but they are not substitute to antenatal care.
Having to,
Yes,
right.
you have to reach
You're ready
your
to
doctor as
always
soon
go
as you are
back to your
pregnant.
doctor.
And that is why we are
Oh.
here to look after you. Yes.
Mm. Well, like the doctor said, don't think that it's okay to have information handy, but visiting your gynecologist is also very, very important because yeah, you're getting all the information. That's why after getting the information, you need to see your doctor. All right, Lagos, let's take this quick breather. On the other side, we'll come back and talk more about those things that you might have heard. Okay, she's a ball of emotion. What does that even mean? Yeah, we'll talk about all that and more, and how you also, if a woman also has certain or ailments, maybe like diabetes, blood pressure, how that can be managed safely, and where you as a partner can come through. Like I said, it's a journey for both people, not just one person. So you need to get all the information. If she's not listening right now, you can get all that information and share with her. But let's take this quick breather. On the other side. We'll continue the conversation here on Smooth 98.1. Drive. This is Smooth Health on the Drive. All right, just a quick breather and we'll go back. It's just about a minute. I will be back to continue our conversation.
Introducing Safri, a lifestyle digital bank that's designed just for you. With one click, you can make easy and fast payment transactions, pay bills, and even acquire easy loans. Hurry and download the Safri app on your Play Store. Visit safrisafri.com for more information. Safri, borderless banking. Now enjoy a great creamy taste with Gano and Gano Cow evaporated milk.
I didn't get that, sorry.
Dry. This is
All right, well, going back in. All right, Lagos, it is 32 minutes gone past 5, and you are tuned into Smooth Health here on Smooth 98.1. My name is Joy Ure, and my guest this evening is Dr. Rotimi Oluwasiji, and he's a chief consultant physician and gynecologist at Iwosan Lagoon Hospital. And today we're talking about maternal health. For those of you who just tuned in, yes, it is important to have this conversation because it's not just about the woman. She's the one carrying, I agree. But you as well, if you're the husband in her life, man in her life, it's a journey that involves both of you. And for those around her, yes, you also need support. So how can you also lend a supporting hand or, be a shoulder when she needs one? That is what we are talking about, and you can share your thoughts as well. You have questions you want to share? You can come through on WhatsApp. The number is 0809-444-0981, and I'll take your contributions and your questions as we go along. All right. Now, let's get back into the conversation. I already see a question popped up, but I want to get this out of the way first before I get into the questions that have come up. I know that it's usually said that a woman is a ball of emotion when she is pregnant. However, how can one, help in that situation? Because you're not able to tell when it's a normal stress and when it's something, because postpartum depression is after she's gone through the process, right? But how does one help with managing a woman's emotion, especially from pregnancy, well, pre-pregnancy, pregnancy, and then post-pregnancy?
Thank you. It is said that pregnancy is a physiological state, but it's not devoid of challenges, both mental, spiritual, emotional. So a pregnant woman actually needs a lot of support.
Right.
A lot of support from husband, good husbands, fantastic husbands, husbands, relatives, doctors and nurses and everybody. It's a pregnancy, you need support. And
Right.
one of the outcomes, one of the determinants of outcome of pregnancy is how supportive, people that surround that woman is. I can imagine. I used to tell my people that it's only that woman, not even a gynecologist, will know the enormity of what that woman is facing.
Right.
And I used to say that pregnancy doesn't have customer. The fact that the first pregnancy went on smoothly, it doesn't mean that the second will go that way. You understand? So pregnant women need a lot of support. I just want to tell the husband, don't say this woman should take her drugs. Stay with her, let her take that drugs where you are there. You understand?
Okay.
Yes, it's not easy to take drugs every day. Women need to be motivated.
Right.
There are a lot of things that once you are well motivated, it gives you, this confidence to pull through. You understand? So the outcome of pregnancy determines, one of the determinants is how supportive people that surround that woman is. You understand?
And that
Pregnancies that are associated with a lot of it, they are also predisposed to postpartum depression. However, by the time the woman is with you, a gynecologist, those are the things you can you preempt it and you actually speed up and start managing. You understand? Iwosan Lagoon Hospital is a center of excellence for mother and child hospital care. So I will encourage you, whenever you get there, we are always there to look after you. We look at we look at these factors that surround you, support you through the pregnancy, and make sure that postpartum is supported at Iwosan Lagoon Hospital in Ikeja. We are always there to assist you as a pregnant woman. Thank you.
Okay. All right. Now that you've actually touched on something, which is medication, I want to get in this question, and this is from Charles Chidozie, and he's asking, right? So, indeed, you've mentioned folic acid, and he says it's true. A woman has to take it. However, is there a natural alternative for that? Because, like he says, over dependency on pharmaceuticals is quite worrying, and also to avoid being addicted to such things. So, is there any other alternative, that natural alternative for that women can start or be using to replace folic acid? I'm also on this trajectory. Let's learn.
Yes, fruits and vegetables are natural sources of folic acid. However, there are some things we may not be able to control. How you cook the vegetables, the sources of some of them, by the time you finish cooking vegetable, it's no longer a vegetable. It's just that's what you have overcooked the nutrients.
Right.
You understand? And science has told us the daily requirement of folic acid, daily requirement of iron in pregnancy. We try as much as possible to target it at that. You understand? Because most of the things, but to be very factual, fruits and vegetables, they are rich in folic acid. But one cannot be sure that you are going to get the right quantity because of the way we cook and store. Some people will have vegetable in their freezer for 2 months before they eat. All those things they don't make the quality of some vegetables to be okay. But one can start you on the appropriate dose per day of folic acid, and it will take you through. You understand? So there are natural sources. The only thing that we are not sure of processes and the storage. We are not sure of the adequacy of such for us to take us through pregnancy. That's the only reason. Yeah.
All right, Charles Chidozie. Well, he says he knows how to cook his veggies. Glad you do, and you're helping. You were helping then, because I know that you're not on that journey right now. So it's good to know that you also do your own little homework and help out when she needs it. And this one, I have heard some people, even doctors, complain about this, and it has to do with women who sometimes skip antenatal appointments owing to their busy schedule, or as they say, I'm just tired now. Is it not the same thing every other time? What's new that the doctor is going to tell me? So how important are these visits really? Is it something they can skip?
Yes, the importance of antenatal care cannot be overemphasized. Okay. You agree with me that prevention is always better than cure.
Indeed.
Antenatal care is a form of preventive medicine. Where when the woman, we don't do the same thing every day. No. In our own antenatal care, we look at the total woman. You understand? If you enter my clinic, if I see that you are not happy, you must be happy before we start that clinic. I must make you happy before you start that clinic. Then we now go to the medical aspect. I ask you, between the time you saw me last and now, what has happened? What has changed? A lot of things. By the time you finish that clinic, even the woman will agree with you that yes, this is very important. And
I like that.
You see some women, they'll say, my doctor has said I should not do this. My doctor has said I should do this. You understand? So when you build that level of confidence, it goes a long way to ensure compliance. And you never can tell. Some conditions in pregnancy are dramatic. You see a woman in the morning, blood pressure okay. In the evening, the woman has started convulsing. You take the blood pressure, it's hitting the roof. You understand? So that's why we encourage our women to attend antenatal clinic regularly. We also do it in such a way that we don't use it to bore them. From the first week to when you are 28 weeks, we give antenatal appointment every 4 weeks. From 28 weeks to 36 weeks, see us every two weeks. Then from 36 weeks to delivery, you see us every week.
Every other
So
week.
make sure that there are not too many. At the
Right.
same time, they walk the wire. You understand? So because you never can say, and at every point anything goes wrong, you always refer to your doctor. You
True.
understand? Then, in order to also assist, sometimes we give them contact to call. Some of them, they call you, say, Madam, if this is what you are feeling, please meet me in my hospital now. You understand? Some, we just encourage them, I have this abdominal pain, Madam, change your position. So it's not every time we encourage them to come, but please, I want to appeal to all of them, all our pregnant women, don't miss your antenatal clinic. Don't miss your antenatal clinic. We also make it spicy. We talk about your family, talk about your work.
Right.
We address your husband, talk to the husband. If your husband is doing well, Madam, this your husband is, this your wife. Oga, this your wife is extremely beautiful today. Continue taking care of her.
Nice.
Those are things we do. You understand? So it makes it a very enticing clinic, and the goal is to make sure that we deliver a pregnant, a healthy baby to a happy mother after antenatal clinic.
And that really is something that they look forward to, having their babies healthy in their arms. But talking about healthy, right? Let's even talk about the exercise a woman should actually be getting up to. I've seen where some women are 7 months and they're hitting the gym like they're not even, it's almost like the pregnancy is not even there. And I'm like, how did you do that? I want to know, what's the safe balance for women who are pregnant, and how do they go about getting in all that exercise?
Exercise is a very important concept in pregnancy. It gives mental alertness, and it promotes the woman's health. However, it must not be too rigorous. You understand? Because the baby is in question. You understand? It must not be too rigorous. We must try and maintain a balance. I encourage my pregnant women to walk around. Not to go to gym. Not to go to gym. Now, in Iwosan Lagoon Hospital in Ikeja, we are introducing a concept of physiotherapy for our antenatal patients. You understand? During that physio, you complain, they massage you, they teach you some exercise, the one that is okay and safe for that pregnancy. So we have introduced that to also make sure that our pregnant women are not redundant. You understand? Because there are some disease conditions, there are conditions that may happen in pregnancy if the woman is not too mobile, if she's not mobile enough, and those conditions are actually dangerous. Very good example is pulmonary thromboembolism. So during the course of antenatal, we also introduce them to physiotherapy. So we are one of the first set of hospitals that are bringing out this concept. We have experienced physiotherapists to look after them. So when they come, so that you teach them how to do some exercise, massage, and even the one that they will also continue while at home, all in a bit to look after them in totality. That's what we do.
I have a response to the exercise. Someone is saying, why does she need the exercise when she doesn't need 6 packs? It's not about the 6 packs, it's also to help her during her journey. But thank you so much. That's on a lighter note anyways. Yes, time is not our friend, but before I let you go, I've heard these myths, and I want you to help me in a minute or less talk about this. And it has to do with, hey, you're pregnant, you're eating for 2, so eat up and don't feel shy. I've heard that one time too many. How true is that? And then there's also this one that once you're pregnant, you shouldn't be raising your arms, you shouldn't be carrying things, you shouldn't, you know, Just you shouldn't even
Now,
do anything.
to answer that question, pregnancy is not a disease. Okay?
True.
It is a physiological process.
Okay.
However, we should try as much as possible to limit the level of our work. You understand? And then there are some conditions you also want a woman to be on complete bed rest. You understand? If such a
Right.
condition arises, we advise. Apart from that, we also encourage our pregnant women. I'm usually very happy when I see them. They are smart looking, they dress very well, move around, take care of themselves, Some of them, they're even more, they are more beautiful when they are pregnant
When they're
compared to when
pregnant.
they are not pregnant. You
I
understand?
know,
So we
right?
usually encourage them. We are happy seeing them like that. You understand? So that's why in antenatal classes, in antenatal clinics, we let them know. Not that they cannot cook, even though
Right.
we also encourage their husbands to assist them. The pregnancy is a thing of two people. It's not only the woman.
Just one person.
We encourage them. It's easier for that woman to know that my husband is there. When I'm
Right.
pregnant, my husband is there in the kitchen, doing the house chores and everything. So everything has to be in moderation. You understand? But a pregnant woman should not be too redundant. After all, it's not a disease. It's a very good experience. You understand?
Right.
Thank you.
Okay. That has definitely been an eye-opener and a powerful conversation, if I should say so. So it's very important to have these conversations. And maternal health isn't just a woman's issue, like I said at the outset. It's everyone's business, from when she's starting the journey to when she's on the journey, and even after the journey. Yes,
Yeah.
after she's, come down from that long trip. It's a long trip if you've been through it. Yes, the ups and downs that come with pregnancies. But thank you so much, Dr. Rotimi, for breaking it down. It's been an insightful session. However, how can listeners, those who have further questions, how can they reach out to you, your social media handle, that they can, come across and share their thoughts if they're not comfortable right now? Some people don't want to share their expressions on air, so they'll prefer private
Yes,
consultations. So how can they reach out to you privately?
yes, we have a customer center at Iwosan Lagoon Hospital in Ikeja.
All
So
right.
you go to Lagoon Hospitals .ng. Instagram, we are on Facebook, we are on WhatsApp. So just reach out to us. You can be rest assured. We give you a feedback.
All right. Thank you so much for all that insight. And I trust that you'll have yourself a pleasant evening and the rest of the day.
Thank you.
All right. Lagos, thank you as well